Less than half of Singaporeans surveyed in a new study say that they're financially prepared to deal with cancer. The survey was conducted by the National University Cancer Institute Singapore, research for Impact Singapore and DBS Bank. It polled 1,200 people and is the first of a three-part research series. Our results show that less than a third of respondents are confident that their existing health or critical illness policies can cover cancer treatment costs. Among those who have never had cancer, almost 1 in 3 had concerns over such expenses. Now, these people range from those in the lower to middle income brackets. The ones who aren't covered by insurance say that premiums are unaffordable, and those who are, however, may also not know the specifics of their own policies. These include things like benefits and co-payment amounts. 2 in 3 respondents were unaware of changes to healthcare policies. These include how integrated shield plans bought or renewed from last April will only cover cancer drugs on a government-approved list. Now, NCIS says that such findings highlight the need for education and also action from policymakers.
We have to do a lot of work in terms of making policy wording accessible to people, and just so that people can actually understand what they're covered for, so they don't buy too much and they don't buy too little.
The next phase of this research will include interviews with stakeholders such as social workers, patients and their caregivers. The findings are aimed at helping stakeholders better understand the importance of financial literacy when dealing with the implications of cancer.
And for more, we have Dr. Jen Wei Ying. Dr. Jen is a consultant with the National University Cancer Institute Singapore. Thanks for joining us this evening, Dr. Jen. The risk factors for cancer, I think most of us are generally aware of that. But for anyone who says, what's the risk of myself getting cancer? What would you say to this person?
I think the take-home message is that anyone can get cancer. We haven't identified any one particular cause of cancer yet. We do know that there are certain risk factors like chemical exposure, environmental exposure, which can play a role. But overall, identifying one hard thing has been very difficult. So it's important for everybody to be prepared for that possibility. And cancer is actually a very prevalent disease. It affects up to 1 in 3 people, 1 in 5 in conservative estimates. So it is definitely something everyone should prepare for.
Dr. Jen, in light of the prevalence of cancer and the incidence of cancer and the fact that we know that it can be very costly to deal with, is there, or maybe it is more than one type of cancer that might perhaps incur the largest amount of medical costs for a patient?
I don't think there's one particular type. I think in general, the policymakers, MOH, ACE have done a very good job of ensuring that the most common types of cancer and the first-line treatment for the most common types of cancer are covered by the cancer drug list. The issue is people understanding what their co-pays are, what is not covered in case of they're developing a rare disease. And also, I think protection against kind of not being able to work if you have a cancer diagnosis. All of these things factor in. And then, of course, there are the types of cancers such as the blood cancers, which are the type that hematologists treat, which require you to stay in hospital for extended periods of time because the immune system is extremely weak. Those kind of costs can add up. And so I think in general, it's more of a kind of awareness as to the kind of means that are available to help. And this study has highlighted that, people are, generally very worried about the cost of cancer care, but maybe because, they haven't experienced the healthcare system, haven't interacted with medical social workers, may not be so aware of the different avenues that are available for help for Singaporeans and permanent residents, which is definitely something we want to raise awareness on.
Dr. Jen, I think for many people, there's the fear you'd rather not know, because if you do know, that might be even more frightening. That is what one might imagine. So could you say in any way postulate a correlation between household income and therefore, I suppose, awareness of financial literacy and how prepared a person might be to pay for, I suppose, extended cancer treatment?
That's a very good question. I think what we did find in our study is that, these concerns about cancer care costs, they spread across the income spectrum. So it's not just people who are low income, middle income, even high income earners do have these concerns. I think what we can do to prepare is to focus on, available policies to help cover the people who may be less covered, say like middle income people who, they're in the sandwich class. And I think that in general, the education surrounding this topic is extremely important. So, in terms of availability for help, there is help available. And, I do want to reassure people that nobody in Singapore will be denied treatment because of unaffordability of healthcare. In terms of not wanting to know, I think the problem with cancer is that even if you don't want to know and it affects you, it's better to be prepared than to be unprepared.
Dr. Jen, it certainly is important to be prepared and to have that knowledge, as you say. Why then do you think, what's at the crux of why it's so challenging to get people to be adequately covered? I mean, if the statistics or the data that shows up in the survey is true, and there is such a high prevalence of Singaporeans who are concerned about not being prepared, why? What are the challenges, or what stands in the way of them getting the cover that they need?
I think the key thing to take away from this study is that it is a perception of being unable to afford care. It may not be the reality. And there's a lot of perceptions about how, we may not be able to afford X, Y, Z if something happens. There's two prongs to this. Number one is, the reality. Is it really unaffordable? And I think to a certain extent, the government has helped to address that, to a large extent, actually helped to address that with the cancer drug list. In terms of people who having coverage, there are actually a high percentage of people who are covered by healthcare insurance. However, we did find that some people don't actually understand what their coverage means. What are their co-pays? What are their deductibles? What's excluded? And in terms of, the difference between critical illness insurance, health insurance, those boundaries are a little bit blurred. So, we need to make these products, policies accessible to people in terms of understanding, what they're actually buying, what is actually covered, just to make sure that the proper bases are covered. For example, critical illness insurance is not healthcare insurance. It's meant to protect you from income loss. And, healthcare insurance is meant to help to cover the cost of healthcare. So they're actually complementary rather than, replacement for each other.
And final question, Dr. Jen, that cancer drug list you mentioned, it was launched in September 2022. One aim was to bring down insurance premiums. Has that actually happened? Final question.
I think it's a bit early to tell. We're going to need to be able to analyze the data as we move forward. I think it's overall a good step in terms of health economics for the country because cancer care costs are ballooning and we do need to address them somehow. It's good to standardize management in an evidence-based way. And, I really do hope that insurance premiums will come down because, all of us pay insurance premiums. But I think that data will take time to mature and we will only be able to see the results of it in a few years' time once there have been knock-on effects on the healthcare costs.
Thanks so much for joining us this evening, Dr. Jen Wei Ying from the National University Cancer Institute, Singapore.